Carbon monoxide intoxication is a very common accident that can be observed in the environment, and it's basically the medical legal aspects are usually related to the accidental causes. Now, these accidental causes can usually be relating to the agricultural point of view. The industrial accidents are again very important, but the domestic cases can never be forgotten because it's usually observed even in the domestic appliances. Any faulty appliances can be a cause to this carbon monoxide poisoning, which is very important. Now, as we have talked about the accidental causes, the homicidal and the suicidal cases are again very important. And a lot of cases have been observed in which these deaths were caused due to the homicide and due to the suicidal intentions. So they cannot be ignored in such carbon monoxide poisoning cases. In this section, primarily, we'll be dealing with the causes. Causes, of course, when we are talking about the domestic, industrial origin, or whether it is of a domestic origin, these incidents are categorized accordingly. Now, the autopsy findings are again very important. Conducting an autopsy, which is in which you are suspicious of a poisoning that is carbon monoxide. What are the characteristic findings in such a case? Of course, the discoloration of the hypostasis is again very important. Now, the blood analysis are of course very important. Blood sampling is very important. It is sent to the chemical pathologist for further reviews, and certain levels are very important for the diagnosis of any detrimental poisoning which cause fatalities in specific cases. So all of this will be discussed here in this third section primarily. Now, talking about the causes of the carbon monoxide poisoning. You have to keep in your mind that this poison can't be smelled, it can't be seen, it can't be heard, and it can't be, but it can be stopped. So it is an invisible and it doesn't have a taste, it can be heard. So all of this is very specific to this kind of a poison, which is basically a gas, and it can be very poisonous. It can reach up to high levels in your blood and cause any fatal condition. So this is very important. And what are basically the causes to this carbon monoxide accidents or homicides or suicides? It's basically motor vehicle exhaust gases. So any faulty motor vehicle exhaust gases can cause such accidents in which there is a lack of ventilation and the carbon monoxide levels rise to a level which is fatal for the individual. It can cause such deaths. Now, the domestic appliances. Of course, the lack of ventilation is basically the major cause behind it. Any faulty appliances, for example, the gas heaters, the water heaters, the geysers, the compressors, all of these are basically contributing to these domestic kind of cases. Any appliances, even in the washrooms and the bathroom accidents, the bathtub deaths are quite related to these carbon monoxide poisoning cases. So they have to be kept in mind. Now, the structural fires, of course, any kind of fires, they can go along with these carbon monoxide cases, and these are going to basically bundle upon the poisoning case, because burns are also going to be there, and it is very difficult sometimes to diagnose whether there was the carbon monoxide poisoning or not. But the blood samples are again the mainstay over here. We have to send them to the histopathologist, and he is going to basically tell us the levels of the carbon monoxide in the blood. But here one point is very important. Firearm injuries, even the entry wound, due to the combustion of gases, there are slight raised levels of carbon monoxide at the entry wound of the gunshot. So even some writers have commented upon it, like the entry wound is even identified through these blood levels of the carbon monoxide at the site. So it's again very important to determine if there is any gunshot wound on the dead body or not. Then the industrial processes are again very important over here. There are different kinds of industries, and the lack of the machinery, the faulty machineries, can again contribute to such incidents of the carbon monoxide poisoning. Incomplete combustion, is again very important, and we have to keep in mind these incomplete combustions as well whenever we are talking about these carbon monoxide poisoning. Now, the autopsy in carbon monoxide poisoning is very important. What are the findings? This cherry red discoloration of the skin is very evident over here, and it's again very important and evident, and basically pointing towards the death due to this carbon monoxide poisoning. The pinkish coloration in the areas of the postural hypostasis. So it's basically a pinkish hypostasis in such deaths, which is the highlight of the autopsy. Then the blistering of the skin, even the mouth ulcers and the blisters on the inner surfaces of the mucosas are again very important, and they are quite evident in such deaths with carbon monoxide poisoning. Even due to the fires, there can be blisters or barbiturate blisters are over there. But of course, these barbiturate blisters have to be distinguished from the carbon monoxide poisoning blisters by calculating the levels of the barbiturates or the levels of the carbon monoxide in the blood. Now, the color changes in the blood and the muscle is again very important. There are a lot of color changes that take place in the blood. It's basically the blood becomes thicker and more dark and tinged in carbon monoxide poisoning, and the muscles are also given a darkish color in this kind of poisoning. Now, the histological examination is very important, and the liver, the brain, the kidneys are all sent to the chemical pathologist for further assays. Now, the blood tests are again very important just to get an overview of the carbon monoxide concentrations in the blood, and the pulmonary edema is again very important. The pleural infiltration, it's going to give an evidence regarding the carbon monoxide poisoning, whether the death was caused due to it or not. There are tiny focal necrosis in the myocardium, and there is some sort of a delayed death in the myocardial tissue. So the myocardiopathies are again very important over here. So we'll be discussing that as well. Now, the blood analysis is again very important. There can be a reduction in the oxygen transport. A percentage saturation of the total available hemoglobin is very important, because it is going to give the symptoms accordingly. If it is less than 10%, there are no symptoms at all. If there is the concentration is between 10 to 20%, there is a slight headache. And then if the concentration is between 21 to 30%, there is headache, slight increase in the respiration, and drowsiness as well. Talking about the concentrations between 31 to 40%, there is headache, impaired judgment, shortness of breath, loss of consciousness, and the blurring of the vision is also observed over here. Then if the concentrations are between 41 to 50%, there is a pounding, headache, confusion, marked shortness of breath, marked drowsiness, and increasing blurred vision. So these are the signs, and if the concentration is more than 50%, 51%, which is quite fatal, the person becomes unconscious, and it is eventually the death of the victim is not removed if he or she is not removed from the source of the carbon monoxide into a fresher air for the ventilation. There is a residual non-combined hemoglobin, and the non-dispersive infrared spectrometry and the gas chromatography is again the main evidence that has to be collected on spot. So in this section, basically we dealt with the carbon monoxide poisoning primarily, its causes, and what are the symptoms related to the different blood level saturations of the carbon monoxide in the blood. That is the end to this section. Thank you for watching sqadia.com.